Switching gears, forensic nursing is a special type of training where healthcare and law collide.
The primary responsibility of a forensic nurse is to care for victims of abuse, more specifically rape and sexual assault victims. Yet there aren't very many. I'm sorry about that. Nurses trained in Brazos County. Now, KAGS HD News reporter Shar Parker takes a look at the shortage of forensic nurses in our area and how the Texas A&M Health Science Center is hoping to fill this gap.
This is a rape kit.
A buccal sample.
Certified forensic nurse and clinical professor Tricia Sheridan walks us through the tough but stern conversation she has with some of her nursing students.
When we're talking with students or nurses, we want to make sure that they're treating the patient and not the kit.
As a forensic nurse, Sheridan is specifically trained to deal with patients who have been victims of traumatic situations, including but not limited to rape and sexual assault cases.
Sexual assault is not a crime of sex, it's a crime of power. So the most important thing as a nurse that we can do is return the patient's autonomy.
And she says there's a shortage of nurses in our area able to do this. It's also one of the reasons why she is working with the Texas A&M Health Science Center College of Nursing to create a first-of-its-kind Department of Forensic Nursing in Texas. In 2013 alone, there were 129 reported sexual assault cases in Brazos County and only a handful of nurses to treat them.
That forensic evidence is crucial to get that early on. So as soon as the victim comes forward after that assault has occurred.
Today, there are less than 5 certified forensic nurses in Brazos County. Martha Garcia Opersini, executive director at the Sexual Assault Resource Center, says these nurses play an important role to sexual assault victims.
They empower the survivors right away by allowing them to make choices. They let them know what the next step is, what the procedure is, and they give them a choice.
The first thing we say to the patient is that we are nurses, we don't work for law enforcement, we work for the hospital.
Assuring the patient that their well-being is a forensic nurse's main concern. In College Station, Shar Parker, KAGS HD News.
Texas A&M is asking the state for support to advance forensic nursing degree options as part of its 2016-2017 appropriations request to the Texas legislature.